NBA Hall of Fame Alonzo Mourning is calling on men to prioritize their health. This after he revealed last week he was diagnosed with stage 3 prostate cancer and beat it. Prostate cancer impacts millions of men in the U.S. every year, but it can be caught and treated. So here with more insight on the disease is RadNet Urologist Dr. Rahul Mehan. Thank you so much for joining us this morning. Really appreciate it. We do want to just start off with the basic question. What are some ways to detect prostate cancer and also treat it?
A great question. Thank you for having me today. I think the number one thing that we can do is blood work. And undergoing prostate cancer screening starts with PSA testing. And that's a simple blood test that you can do with your family doctor. And, prostate cancer is so common. Like you said, this year, 300,000 new cases of prostate cancer will be diagnosed. And there's around 35,000 deaths from prostate cancer this year. It's the second leading cause of cancer death in men and the second most common cancer in men. Very interesting. There's 3.4 million American men living with prostate cancer right now.
Now, since you say that it's, often treatable if it's caught early, why is that not happening? Are men hesitant to go to the doctor? Are we not going to the doctor enough? What's that gap that we're seeing?
Yeah, great question. I think men don't take care of themselves like they should. They're not proactive on their health. As a guy, we're programmed to be a provider and take care of others. And it's hard for us to prioritize our own health and to see a doctor and to get tested. A lot of guys are nervous too when they think about prostate cancer. They think about having a rectal exam. And what they don't know, in today's world, most family doctors don't even do rectal exams. They start with blood work. And that should be done early on for men at high risk. And that includes African-American men. And African-American men are at higher risk of having prostate cancer. They should start screening in their early 40s. So it's hard to get a guy in their 40s to see a doctor, but we need to do better at doing that.
Did that change at all? Did that age range change? Are we now trying to make sure it's detected even earlier and get younger men? Or has that the 40-year-old range, has that been the range for a while?
No, it's changed. So traditionally, prostate cancer, and it's more common as men age. Age is probably the most impactful risk factor for prostate cancer. As we age, men get it, and something that if we live long enough, probably all of us will get it. But there are younger men getting prostate cancer, more aggressive stages of prostate cancer, and the goal is to catch those men. But typically, for an average guy, when you turn 50, you should get a PSA check. But for high-risk groups, and high-risk groups include people that have a family history of prostate cancer, if you had a dad or a brother, or if you're African-American in descent, or if you're Caribbean with Black ancestry, those men are at higher risk of having prostate cancer, should be screened earlier in the early 40s.
You mentioned this twice already, that Black men are at higher risk. Why is that?
Well, it's a great question. And for a couple of reasons. I mean, one, we probably think there's genetics involved. We know being of West African descent puts men at higher risk of having prostate cancer. But two, there's probably a stigma, and in a different culture and different groups, some certain men seek medical attention and other men do not. There's some social economical status also too with testing. And, we need to do a much better job from the medical community to put an arm out and to include Black men into our practices and to encourage them to be screened and tested much earlier.
That makes a lot of sense. At the top of the show, we mentioned NBA legend Alonzo Mourning's diagnosis and then his cancer-free update. I feel like we're in this era now of a lot of celebrities, whether they are actors or sports legends or whatever the case may be, coming forward, telling their own story about their diagnosis, whether it be cancerous or something else. So why is it so important for people in that status, I guess, to share their stories?
Yeah, this has been taboo for so many years. Most guys don't talk about their health. They don't talk about prostate health or prostate cancer and what that is. And, there's a stigma there. And it's so important that we have these celebrities. And I mean, just this year, we've had so many people in the news come out and tell their story. It's important. We got to normalize this. We got to talk about these issues, and we got to encourage men to be tested and to be screened for. We can definitely catch men early, and that's so beneficial.
All right, Dr. Rahul Mehan, thank you so much for being here. Really appreciate you breaking all that down for us.
Oh, my pleasure.
Of course. Have a great one.
Well done.